with integrated electroencephalography. It's very important because I think the EEG is a bridge between the neonatologist and neurologist. Okay, let's go. Hans Berger, it was the first, is the father of the electroencephalography in 1904. Starts electroencephalography in Austria. He was from Germany, but is working in Austria and start the electroencephalography when connect a galvanometer, a powerful galvanometer to one man, and shows the difference in the activity with the eyes closed and eyes open, and is the first in describe this kind of rhythms in the cerebral activity. He is considered the father of electroencephalography. Okay, but what happened? The electroencephalography, it's have an evolution across the time, and the first report of monitoring cerebral function of EEG, it was in 1979, a clinical experience with a new device for continuous recording of electrical activity of brain, published in British Medical Journal of Prior and Maynard, and describes this device that you can make this kind of monitorization continuous, and is the first use of EEG in the world. The use is to make a good monitorization after cardiac surgery, and it's very interesting this table, but because it's a comparison of CFM and conventional EEG. But this comparison in 79, it's very continuous in the actuality. It's very, very similar in this time. EEG, the apparatus is costly. In CFM, it was relative cheap. It is very interesting. The record, how long the recording during cardiac operation, about 300 or 600 meters, and with compressed brief recording of CFM, it's around 1 to 2 meters during cardiac monitorization, during the cardiac surgery. This is a point very important, that is the main, I think is the main objective of EEG. The conventional EEG requires expert eye for interpretation, expert eye and special training. CFM is easy to detect sudden or gradual trends to increase or decrease of activity or stable record. Okay, record technique. The filters of EEG sometimes cause interference, a problem, and CFM is very resistant to artifacts. I will explain later. Okay, it's very, this table is very interesting because it's the truth and is very reliable. Okay, but you can see this this display, this slide, and you can see the record of EEG and the length of the paper. Okay, 3 people are taking the paper to make one interpretation. Okay, and in this moment we don't have this recording in paper, and we can make the interpretation in the screen. What happened in the NICU. What happened with monitorization in the NICU? Okay, monitorization in NICU is very complex, and we can monitor for every function of the baby. I don't know, heart rate, the oxygenation, respiratory rate, but what happens with brain? How can make a monitorization of the brain? This is a question. We can know what happened with the heart, with the lungs, with the oxygen, but what happens with brain? Okay, in this part is very important, the EEG, because it's a way to evaluate cerebral function continuously, and it's equal to a monitor. The raw EEG, it's filtered and compressed, allowing an evaluation of change in electrocortical activity across two visual patterns. The main application is in neonatal period with a limit of 55 weeks in published research. And the application in pediatric period is based on the patterns of neonatal period. What happens with the physiology of cerebral activity in neonatal period? The preterm has a discontinuous pattern. What it means this? In 24 weeks, the cerebral activity has high amplitude and variability, 5 to 50 microvolts, and low frequency. In the 30 weeks, the same activity is more frequent but asynchronic. Okay. Later, I will explain what it means as synchrony and symmetry. 35 weeks. Sorry for this. One Spanish. The activity becomes synchrony. In the term, the continuous pattern is equal to the French nomenclature, the tracé alternante de la nomenclature française. What it means, low amplitude and a variability and more frequent bursts. And the amplitude is between 5 to 10 or 25 microvolts. Okay. This is a very interesting graphic because we can analyze in the different weeks the brain activity. In the 31 weeks, we can see this high variability. The activity has a high upper border and low border is the band spin. It's very with high variability. When you are more close to full term, this variability is less, and you can see when the baby is wakefulness or in active sleep, the brain activity is between 5 to 10 microvolts. Okay, in quiet sleep, the bandwidth span is higher. This is very important because the principal definition to interpretation is 5 to 10 microvolts, and is the base to all the classification. Okay, the preterm infant has this continuous pattern. In this conventional raw EEG of 28 weeks newborn, we can see the brain activity. This is the normal brain activity, and the time of interbursts is long. Yeah, and you can see other bursts of cortical brain activity, and this is the explanation of this continuous pattern, because the frequency of the activity is it's less frequent. It's less frequent. When you have more weeks, this activity becomes more continuous, more frequent, and the time of intervals is less than when the age when it's minor has age less weeks. You can see the intervals time is long, and the intervals time in 40 weeks it's short. It's very important to analyze the trace, see the upper border and the lower border. It's very important. Okay. This sleep-wake cycling, it's very important to know what is the age of the newborn. Okay. When you don't have any cycling in the pattern, you can suspect that the age is less than 31 weeks. When you start to see some cycling, but notice an established cycle, the age is between 31 to 35 weeks. When you can see one cycle mature, established, and it's very different, the bandwidth span in the quiet sleep and the wakefulness and active sleep, this is this means that you are near full term, more than 36 weeks. It's very important to know the ontogeny of the brain activity. Okay, what is the electrophysiological function of EEG? It's a condensate of amplitude variation in the background cortical brain activity that produce a recognizable visual pattern. Okay, but the EEG start of conventional EEG that have a process of amplifier. The filter is very important. What is the filter? The filter is the frequency that can be detected EEG. Okay, for example, the filter of EEG is between 2 to 15 cycles per second. That's equal to hertz, cycles per second. This is very important because it's very resistant to artifacts. For example, a conventional light bulb has a frequency between 70 to 50 to 70 cycles per second. If you have a conventional EEG near from a conventional light bulb, sometimes you can detect the activity of the light bulb, and this is doesn't happen with the EEG because the filter is established in this frequency. Semi-logarithmic amplitude compression and rectification, the process of rectification, smoothing, overload detector, impedance detector, and finally, this is a recorder in a screen, not in a paper. Okay, what happens with the amplitude variation in the EEG? The EEG don't shows all the peaks of amplitude. In the EEG, it's a time compress. Let me show what happens with time compress. And finally, becomes in a visual pattern. For example, you can see this variation of the every peak. In the visual pattern, you only can see the pattern and some notch when the amplitude is lower. You can see this variation and this notch in the visual pattern, but you can see the every peak to peak amplitude. That is the difference with the raw EEG. In the amplitude integrated EEG, you don't have negative waves. All the waves are positive, and this is the process of rectification. Becomes all the waves positive. And it's very important, the time compression. When you after becomes positive all the waves, the time compression starts, and you can see only one line that represents 50 seconds of activity. As said, the summatory of these lines of 15 seconds of activity produce the visual pattern. Okay, the summatory of every line is 15 seconds of activity of in the lower activity with less amplitude is when you can see this interverse time is the low border, and when you can see this bandwidth more higher is the upper border. This is what happens in the AG, is a condensate of amplitude variation. Notice every peak to peak amplitude like in the conventional EEG. What is the technical specifications? It's a touchscreen. The AG has a data acquisition box and easily transportable. Filters between 2 to 5 Hertz. It's very important to artifacts, very, very important. And you can make a monitorization with 3 to 5 electrodes of gold cup of hydrogel. Using modified international system 2020 or a rule of 3, as I will explain. The screen has a semi-logarithmic scale and a continuous detection of impedance. What is the impedance? The impedance is the degree of adherence that every electrode. When the impedance is high, the electrode notice it's a bad adhesion, and when the impedance is low, we have a good adherence in the skin. Okay, this is and in our hospital we have 2 equipments, CFM and one CFM 6000. That is the previous model that this device is very easy to use, and the data box acquisition has a guide to how you can make how you can put the electrodes in the skin and in the head. But we can use a gold cup electrode. This has had the advantage that is reusable, and hydrogel electrode, sometimes you can reusable 1-2 times, but notice the recommendation is only 1 time to use. And what is the International System 2020? Okay, in electrophysiology, the odds number is in the left side, and the pair numbers are in the left side. After too many research, we know that the brain activity in the newborn is concentrated in the central parietal regions. And we can use these regions to make a monitorization of 1 channel or 2 channel. Okay. We use C3 and P3 in the left side, and C4 and P4 in the right side. Okay. What is the rule of 3? The rule of 3 is a very simple kind of to put the electrodes in the head. If you don't need this training in the system 2020 to collocate to put the electrodes in the head. It's very simple. You need to make 2 imaginary lines. In the middle line, yes, and other line between 2 ears. And when the lines cross, you can detect the central point or vertex. And then you apply the rule of 3. What it means, the rule of 3? 3 centimeters to left is C3. 3 centimeters to right is C4, and 3 centimeters behind C3 and C4 is P3 and P4, the centroparietal region. And if you apply this rule, intra-hemispheric distance is between C3 and P3 is 3 centimeters, and the distance interhemispheric is 6 centimeters. Okay. When you are using the 1 channel montage, only are seeing the activity between P3 and P4. And I recommend that use 2 channel because you can make this valoration between the left side and right side, and you can see the synchrony, the symmetry between the both sides. Okay, it's better make this montage in electrophysiology. We call this montage longitudinal montage between C3 and P3 and C4 and P4 because it's independent the side. In this transversal montage, you can distinguish what is the I don't know what is the side that it's has more seizure activity. For example, in this montage, you can distinguish this the difference in the activity. This is an example. In transversal montage, AG, you can see only the activity between P3 and P4. The impedance, it's very important that every trace you can see in continuous form the impedance, and should be less than 2 kilo ohms. And the raw AG you can see in transversal montage, and the velocity that I recommend to make the valorization is 30 millimeters per second. Okay, and this is the difference in the longitudinal montage between left and right side. You can see this is the synchrony. Synchrony, it means you can see at the same time the same activity as synchrony and symmetry. You can see the same shape of the activity into left side and the right side, and the same shape is at the same time. This is when you see synchrony and symmetry, you are talking in a newborn full to term. In the raw AG, you can see the same activity, the same peak-to-peak amplitude. Is very important, this valuation in longitudinal montage. Okay, the screen has a semi-logarithmic scale. That it means notice notice 1 by 1, 5 to 10, 10 to 25, 25 to 50, 50 to 100, and 100 is the maximum of the amplitude in the AG. But in the AG, normally the maximum amplitude is 400 microvolts. The impedance is continuous, and the device has an alarm of impedance. When the impedance is less than 10 kilo ohms, the alarm is in, it's green. Everything is okay when it's green. When the impedance is between 10 to 20 kilo ohms, the alarm is yellow. It's an, maybe you can make check the electrodes, that every electrode, it has a good adherence in the skin. And when the impedance is greater than 20 kilo ohms, it means that one electrode or two electrode has a bad adherence. Okay, the device, you can see the adherence of every electrode: C3, P3, C4, and P4. Okay, one screen complete is, the time is 3 hours of activity. We can see these blue markers between 1 hour of a lapse of 1 hour, and every thin white line, it's 10 minutes. The velocity, the speed of the paper of the record is 6 centimeters per hour. And when you see this in the raw AG is 30 millimeters per second, every white line is 1 second. This is the difference. Okay, let's go to the trace analysis. It's very important, the trace analysis, because we have a very reliable and easy classification like Hellstrom-Westas classification. Previously, Al Nakib in 1999 published one classification that is based in the change of amplitude, but not is reliable because the classification only is normal, abnormal moderate, severe abnormal, and sometimes the normal pattern of discontinuous in the preterm infant, it's equal to abnormal pattern, because this is this classification of Hellstrom-Westas. It's very interesting because I consider this a bridge between the nomenclature of electrophysiology, and it's easy to interpret to one person that not have training in electrophysiology, and you can interpret this is the pattern, the visual pattern, very easy and very reliable. What is the parameters that Hestrom-West task classification? The background pattern, an estimate of burst rate, sleep-wake cycling, and the presence of AEG incisors. Okay, let's go to the most interesting part of lecture, the trace analysis. The normal pattern is in term Newborn. The normal pattern of the term Newborn is continuous pattern. What it means is a continuous activity with lower minimum amplitude around 5 to 7 maximal 10 microvolts and maximum amplitude of 10 to 25 to 50 microvolts. Okay, resume. What is the resume? The equipment device has two markers between 5 to 10 microvolts. This is the most important, as you see in the when I explain in the graphic, 5 to 10 microvolts, it means an activity of wakeful or active sleep. The reason is when the lower border in the continuous pattern is greater than 5 microvolts, okay, is the lower border, and the upper border is greater than 10 microvolts. I have a lot of time teaching about EEG to many residents of neonatology, and we make an visual analogies. Okay, you can see the pattern has this is change in the amplitude, and I prefer use these visual analogies. When you see a snake like this, you are in front of a continuous pattern. Yes, the snake is a continuous pattern. Okay, and you can see the density of the and the color of this pattern is too black or too blue. I don't know what is the color, but when you see a normal pattern in preterm newborn, that is this continuous pattern, you can see the color is different. Not is less, has less density than the other pattern, the continuous pattern, and it means this continuous, the activity is less frequent than the continuous pattern. Yes, this is that means. Okay, this continuous pattern has background with minimum amplitude variable, but below 5 microvolts, and maximum amplitude above 10 microvolts. In resume, lower border is under 5, below 5 microvolts, and upper border is greater than 10 microvolts with high variability. A high variability in this case. Okay, what is the visual analogy? Is like a white belt. A white belt, okay, it's a discontinuous pattern. Okay, we have other mnemotechnique. When you see a discontinuous pattern in the visual in the screen, you can see it's very variability of the amplitude. You can see this variability, and sometimes my student says, Dr. Cesar, we see that the continuous pattern is like discontinuous in the variability of the amplitude, and when they see a discontinuous, the interpretation is a continuous pattern, and when they see this less variability and it's more continuous, the interpretation is a discontinuous pattern. It's an inversion, but I prefer to use the visual analogies. The snake, continuous pattern, and the white bell is a discontinuous pattern. Okay. We're gonna to analyze the abnormal pattern. Okay, these patterns are abnormal and no matter the gestational age. It's very important. When you see this pattern, something is wrong with the newborn. The birth suppression pattern is a discontinuous background because the minimum amplitude is less than 5 and is between 0 to 2 microvolts, and burst amplitude is equal or greater than 25 microvolts. Burst suppression plus denotes burst density more than 100 bursts per hour, and burst suppression minus means burst density less than 100 bursts per hour. What it means? Okay, this is a burst suppression plus. The lower border between 0 to 2 microvolts. This lower border produces a basal line. You can see this basal line, and the upper border is equal or greater than 25 microvolts. Okay. The estimation of bursts is only a visual estimation. When you see a lot of bursts in 1 hour, you can see that is a burst suppression plus. When you see the basal line and the same definition of amplitude, lower border 0 to 2 microvolts, upper border equal to or greater than 25 microvolts, but you can see only a few of bursts, is a burst suppression minus. Okay, what is the analogy? A hair comb, you can see the basal line in the hair comb, and when you see a lot of teeth, is burst suppression plus. And when you see the basal line, but a few of teeth, is burst suppression minus. This is the analogy that I am using to explain this pattern. Okay, the other abnormal pattern, when we continue advancing in the abnormal pattern, it's more brain damage in the newborn. The low voltage pattern, it's a continuous background. Okay, it's a continuous background pattern of very low voltage, around or below than 5 microvolts. Okay. In some too many books or too many papers about AG, maybe you can see the term continuous low voltage. Okay, I will to try to explain, because I think the continuous low voltage not is a correct nomenclature, because continuous, when you know, the continuous pattern is a normal pattern, is the normal pattern of the term baby, and the low voltage is a very abnormal pattern, and only the correct form to name it is only low voltage without continuous, only low voltage. Low voltage is a continuous background pattern of very low voltage or below 5 microvolts. Okay, low border, it's greater than 0, but upper border, it's less than 5 microvolts. Okay, this is like the line of 5 microvolts. And you can see the activity is below the 5 microvolts, always is below 5 microvolts. Okay? And you can see the AG. Okay, this is the visual analogy. Is like a thin belt, like a warming belt, a thin belt that always is below than 5 microvolts. And this is the line of 5 microvolts. Okay. Abnormal pattern, finally, the flat pattern is primarily inactive isoelectric tracing background below 5 microvolts. Sometimes it's difficult to see this pattern because you can see these spikes in the activity, but when the brain activity is loose, sometimes the device can detect the heart rate. And okay, let's go to count every white line. It's 1 second. In 6 seconds, 1, 2, 3, 4, 5, 6. How many spikes we have? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. Okay, in 6 seconds we have 14 spikes. If you make the multiplication by 10, 140 is the heart rate of the baby had in this moment, but it means the activity not is the brain activity. The brain activity is totally loose. Is not the baby don't have any brain activity, and sometimes you can detect the heart rate. Okay, it's sleep-wake cycling. The sleep-wake cycling are sinusoidal variation, mostly in the minimum amplitude and the broader bandwidth. Is more when the broader bandwidth is represents discontinuous background activity during quiet sleep, and the more narrow bandwidth, okay, corresponds to the more continuous activity during wakefulness and active sleep. Okay. What is the sleep-wake cycling? When in a trace you don't have any variation, any cyclic variation, that is a discontinuous pattern, a typical discontinuous pattern with any variation. The pattern don't have any cyclic variation, is a preterm newborn less than 31 weeks. Okay, when you can see some but not fully developed cyclic variation of the lower amplitude, but not developed as compared with normative gestational age representative data. Okay, this is the imminent or immature sleep-wake cycling. Okay, when the bandwidth is broader, here is quiet sleep, and when the bandwidth is narrow, it's wakefulness or active sleep. In the immature sleep-wake cycling, you can see this cycling similar to burst suppression. Yes, this is a basal line with the burst, and the immature sleep-wake cycling looks like burst suppression pattern, but you can see duration is around 20 minutes to 30 minutes. That it means the baby is sleeping. Okay, and the develop of mature sleep-wise cycling is clearly identifiable sinusoidal variations between discontinuous and more continuous background activity by cycle duration more than 20 minutes. Okay, when the bandwidth is broader, quiet sleep, and when the bandwidth is narrow, active sleep or wakefulness. Remember, the active sleep is equivalent, it's the same of the movement, rapid eye movements in the sleep of the adult, and it's the same activity in active sleep when the baby is awakeness. Okay, and you can see this bandwidth broader, the low border, it's around 5 microvolts, no below. This is a classic continuous pattern with a developed mature sleep-wake cycling, and this is a classic discontinuous pattern with this burst suppression with a duration of 20 minutes. This is the quiet sleep, and it is a discontinuous pattern with an immature sleep-wake cycling. Okay. This is a resume of in the same continuous pattern, minimum amplitude more than 5, maximum amplitude 10 to 25, normal, discontinuous, less than 5, and the minimum amplitude, and the low border, and the upper border more than 20 microvolts. Yeah, it's normal until 35 weeks, abnormal after 31 weeks, and pathological patterns. That it means no matter the gestational age, always are abnormal, burst suppression, low voltage, and flat. Okay, this is the published in pediatrics by Zhang in the maximum activity report the age that is reporting, and in the gestational age is 55 weeks. And this is a very interesting graphics, because you can see in around 39 weeks, the active sleep has more amplitude than in the lower border than quiet sleep. After 40 weeks, the quiet sleep increase the amplitude of lower border, and the active sleep lower border becomes more non-negative, but it's minor than the active sleep. In the pattern, you can see the classic snake in the continuous pattern, but the snake after the 40 weeks becomes different. Why? Because when you see this amplitude, amplitude is lower. Now you are talking about wakefulness or active sleep, and when the amplitude is greater, is high, you are talking about quiet sleep. Yes, after 40 weeks, the amplitude has an inversion. Quiet sleep, high more amplitude, and active sleep, less amplitude. It's very important to this interpretation. Okay, you can see in resume this table, this display, this slide. Okay, less than 31 weeks, you can see a discontinuous pattern with no sleep-wake cycling between 31 to 35 weeks. You can see this continuous pattern with immature sleep-wake cycling. That immature sleep-wake cycling is like a burst suppression, but the duration is very important to know. That is a sleep-wake cycling. It's very important. More than 35 weeks, you can see the bandwidth span broader is quiet sleep, and when the bandwidth is narrow, is awakeness or active sleep. Okay, this is a typical pattern, continuous pattern with a snake. Yes, with amateur sleep by cycling. And finally, when you see after 40 weeks, you can see this increase of the amplitude is quite asleep, and when the amplitude is the lower border, it's below than this border is wakefulness or active sleep. That is the inversion. Okay, you can see the lower border in quiet sleep before the 40 weeks is below than active sleep, and after 40 weeks becomes an inversion of this amplitude. Okay, finally, most interesting of trace analysis, the seizures. Okay, neonatal seizures are repetitives and high voltage. To be detected by AG, duration of seizure should be more than 30 seconds. And what happens when myoclonias? Okay, the advantage of myoclonias is that they are very repetitive. Tomorrow we got to analyze some two cases of myoclonias detecting by AG. AG usually is seen as an abrupt rise in the minimum amplitude and a simultaneous rise in the maximum amplitude, often followed by a short period of decreased amplitude. Okay, it is very important to understand what happens with the background pattern. The raw AG shows simultaneous seizures activity with a gradual build up and then decline in frequency and amplitude of repetitive spikes or sharp wave or activity with duration of at least 5 to 10 seconds. Okay. The analogy to understand what happened with the minimum and the maximum amplitude rise and becomes in an epileptic mountain. This is the rise of minimum and maximum amplitude, and you can see the epileptic mountain. And the classification of Hallström-Westoff to seizure is a single seizure when you see only one seizure in 3 hours in all the screen. Remember, on the screen, 3 hours. Okay, if you see only a solitary seizure, solitary mountain, you can see the interpretation is a single seizure. Okay, it's very important make the value of the AG pattern and the raw AG. You can see in the left side the mountain, and when you see the raw AG, you can see this pattern, this graph element of 2 spikes and a slow wave, 2 spikes, a slow wave. Okay, remember in the neonatal seizures are repetitives and sometimes you can see the same wave, and the same wave has more amplitude, and this produces the epileptic mountain. It's very important to see in longitudinal montage, because you can see that the left side is producing this scissor, and when you see this, it's necessary to make one brain image, I don't know, an ultrasound, MRI, because it's probably that in left side you can find lesion that is the explanation of the seizure in the left side in this case. Some devices, some AG devices have a software of automatic recognition of seizures, and it works when the software detect 5 or more waves with the same shape and the same amplitude. Automatically the device put one marker when it's happening when it's happening this activity. The activity, the duration of activity to be recognized with these softwares should be around 20 to 26 seconds to produce this marker. But be careful, because some artifacts can be confused with seizure activity. Okay. And the next classification is repetitive seizures. A single seizure appearing more frequently than at 30-minute intervals, more than one, okay? We can see 2 mountains, and the main activity is in the left side. But you can see in the raw EEG, you can see the waves, the peak amplitude. You can see the shape form, and the amplitude is higher in the left side than in the right side. What it means that the main lesion, hemispheric lesion, is in the left side. The main activity in the 2 traces, AG and conventional EEG, is in the left side. It's very important because we need to make one MRI or one ultrasound to demonstrate what happens in the left side. Okay, and finally, the status epilepticus is continuously ongoing seizures activity for greater than 30 minutes, okay? You can see these mountains, repetitive mountains, and what is the duration? Remember, every white line, it's 10 minutes. 10, 20, 30, 40, almost 50 minutes that of this seizure. You can see the mountains when you have an status epilepticus sometimes is decreasing the amplitude, and when the seizure activity continues, dawn becomes lower, dawn becomes lower, and becomes rise activity. This activity is always in the upper border and is higher than the background activity. And you can see this is like a Russian mountain. I say this is very a lot of mountains. Summatory, a set of mountains is very indicative of status epilepticus. Other form that you can see in status epilepticus is this sawtooth pattern. In this trace, it's very important to analyze the background pattern. You can see the background pattern is like a hair comb, it's a birth suppression, and you can see these small mountains. But when you analyze the raw AG, you can see this graph element that is two spikes and a slow wave. And this is an status epilepticus that is bad prognosis because the background pattern is abnormal, very abnormal. Is a birth suppression minus, yes, minus than 100 births per hour. And is very clear the status epilepticus in abnormal activity background. That it means the baby is very affected or have a very neonatal encephalopathy, very severe. Okay, and finally, this is a set of mountains. This is a status epilepticus, very typical status epilepticus. And finally, you can see how is the change across the time of the graph elements of the raw AG. Okay, the scissors in the raw AG has a life cycle, and notice it's very important to distinguish between artifact or scissors. The scissors the trace not is equal. It's the scissors has an evolution across the time. You can see these poly spikes. You can see this spike and slow wave. And finally, when we use phenobarbital, change the stop the scissor activity and becomes in a low voltage pattern. Okay, this is very important. The scissors life cycle, it's I think this life cycle, this evolution across the time is the most important form to distinguish to artifact, because the artifact sometimes becomes equal. It's across the time, don't have any evolution. It's very similar in all the time. And the scissor has a start born, and the amplitude is increasing, a progression, growth, increase the amplitude, status, reproduction becomes frequently, and finally death, end, and the amplitude decrease. It is very important to make the differentiation between artifacts. AG and scissors. AG sensitivity, only the AG, the pattern of the mountain, has a sensitivity of 27 to 56%. Okay, but the raw AG, only a conventional raw AG without video, has a sensitivity of 49 to 75%. And 75% is when the baby has a sleep deprivation. Okay, but when we make the combination of AG, the mountain, plus the raw AG, and we can identify the shape of the wave, the sensitivity increased to 66%. Okay, it depends of experience of examiner, scissor durations, peak-to-peak amplitude, automatic recognition, like recognize software, detection of subclinical scissors, monitorization. Okay, it's by 24 hours. It's very important. If you are suspecting subclinical scissors, the monitorization could be 24 hours by AEG. If you watch scissors in AG, please do not hesitate. Please, because remember that you have only one or two channels. If you don't watch scissors in AG, be careful and caution, because polygraphy and video EG continues be the gold standard. Recommendation: the minimum duration is 90 minutes, 1 hour and a half to establish a pattern, but because it's very important at the time to detect the amplitude variation. But if you have one baby, maybe a candidate to hypothermia in the window, you can make one trace of 20 to 30 minutes. It's very important, make longitudinal montage to make the value of interhemispheric evaluation. Sedatives, opioids, and antiepileptic medication may all depress the electrocortical activity, and maybe a continuous pattern becomes discontinuous, a discontinuous breath suppression, low voltage or flat, and the evaluation of AEG background activity may become uncertain for 1 to 2 hours following administration of sedatives and opioid analgesics. It's very important to be careful when the use of this medication and the interpretation of AEG pattern. Okay, some artifacts. The artifacts in this case, loss of left electrodes. Okay, you can see this is the impedance graphic. And you can see in the left side how the impedance rise and it's rise across the time, and the amplitude it's loss. This is what it means, that the electrodes of left side are bad adherents, and you need to check what happens with these electrodes. Okay, when you see a rise or amplitude in the background of AG, you need to analyze the impedance graphic, because sometimes you can see a rise of impedance, and this is rise of impedance are in the same time of the amplitude increase. That it means notice and brain activity. This is an electrical activity because the electrodes has a bad adherence, and sometimes you can detect the electrical activity around of the baby and not is the brain activity. It's very important to check the impedance and the trace of AEG at the same time. Okay, this is a very interesting pattern, because you can see a background pattern, a scissor pattern, and artifact pattern. Okay, you can see what is the background pattern. You can see this basal line and teeth. This is a hair comb. Please When you make the interpretation, don't use the visual analogy. Remember, a snake is continuous. White belt is discontinuous. The hair comb is birth suppression. Only make this relationship in your mind, and when you make the interpretation in the baby, or I don't know, the outcome, the result, the report, only use the nomenclature of the Hedstrom-Westas classification. Okay, you can see in this birth suppression, and you can see mountains, but the mountains sometimes are very dense. What happens? Okay, this baby has scissors, but the scissors involve the face. And when the baby has scissors and the face and the muscular face is contracting, you can see this spike slow wave, but this slow wave has a lot of spikes like electromyography. This is the muscular activity. It's very similar and electromyography. This is the importance to make the examination at the same time of the mountains and the raw AG. It's very important. Okay. Asymmetry by short distance between electrodes. You can see this. This is a pattern, abnormal pattern, this is birth suppression, but this is a low voltage. But why happens? Well, what happens in this trace? Okay, you can see the distance between left side, it's higher, and this is shorter in the left side. What happened here? You can see less activity, less amplitude, because the electrodes are very close. Notice, it means that in the right side you can suspect that you can that the baby have a damage in the right side, but no, it's the electrode collocation that is wrong. Finally, I think this happens very frequently in our hospitals. The artifacts by high frequency ventilation. Okay, this is a preterm baby with high frequency ventilation. I tried to demonstrate the vibration of the cables, but you can not is possible. But you can see the trace. Okay, it is the difference with the scissors. The artifact is very similar across the time. Don't have any evolution. And finally, you can see the vibration of the tubes. The tubes and the cables it was the same vibration. What happened then? We make one fixation of the bed. Okay, here. And the pattern was very different. You can see the same shape wave, but it's very different because the vibration, it was the explanation of this kind of raw AG. Okay, I don't know what happened. Okay. This is the explanation. Across the time, the artifact is very similar. And you can, if you count in 1 second, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It was the frequency of the ventilator. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This is the explanation of this artifact. Okay, and the artifact is very similar across the time, don't have any evolution like scissors. Okay. Finally, interpretation, like this is I try to to make the colors of Indian flag. You need to make a choice of one option of every column. What it means? Okay, the background pattern, it was continuous, discontinuous, burst suppression, low voltage, flat. The slave-wise cycling don't have slave-wise cycling. It's immature or is developed slave-wise cycling. And finally, scissors. No scissors, it's a single scissor, repetitive scissor, status epilepticus. Example, the final example, I think is a good example. How you can interpret this pattern, okay? This is the final, okay? The background, burst suppression. Slab-wise cycling, no slab-wise cycling, no slip-wise cycling. And status epilepticus, and you can make a choice of every column, and this is the form to make the interpretation of AEG. Okay, this is the last slide. Thank you.